To one of our top stories, we all know that all medicines have side effects. If we read that package insert, that little piece of paper that you and I don't read, try it one day. You might get a bit of a fright. But those are some of the most common pills that we use. If we did that, we might think twice about taking them. Now, though, there are concerns about a report into the side effects of Pfizer's COVID-19 vaccine. Or let me be specific. What I mean is it shows the jab has over 1,200 side effects. It's a number of pages that fold out, apparently. So to explain whether or not we should be worried about this, let's welcome back to eNCA, always a pleasure, health expert, Dr. Fundile Nyati. Dr. Nyati, good morning to you. Thanks very much for your time. So the number of side effects in a vaccine like Pfizer, does that concern you? Do you get a bit of a fright when you see the piece of paper?
Well, like you said in your introduction, all pharmaceutical products, tablets, injections, vaccines, they've got a potential of causing side effects. In fact, they do have side effects. And it's important for people to know, beforehand about the common side effects. Like you just said again, even ordinary aspirin has side effects which can actually be deadly. For example, if you've got a problem with ulcers in the stomach, they may actually cause you to bleed to death. So the issue of side effects is something that we must all understand with pharmaceutical products. But what is important is for us to be able to know those very rare and very serious side effects that may lead to death. And in this instance, the list of 1,291 possible side effects, or what we call adverse effects, is actually something that is worrying many people. But when you listen to the guys from CDC, they are basically saying 92% of the side effects listed there were so mild that there wasn't really a major issue with them. It's only about 1% of those that actually are serious and needed serious attention, from a medical point of view. And so here we're really talking of a small percentage of very rare side effects. But obviously for the average person on the street, seeing 1,291 side effects or adverse effects is something that is scary,
It is, and this was never kept a secret. Even in the early days, before the vaccine rollout, Dr. Nyati, people were being warned this 1% could potentially be those that have got comorbidities. They have multiple underlying conditions. You may have heart disease and also diabetes, and you may have had a stroke. And the list goes on and on and on. It's a very small number. And even health experts then were saying, if you fall into a category where perhaps even you're just on chronic medication, seek medical guidance before getting the vaccine. Does that still stand true these days?
Well, I think it still stands true. It still stands true. But I think also, once again, in preparing for this interview, I was looking at how that list came about. So it's not all of the side effects that did happen. It's also side effects that were anticipated to happen based on, stuff that was picked up during the human trials, phase 1, phase 2, phase 3. But also then what they call post-authorization, the surveillance that happens after a drug has been approved. Some of the stuff that was reported by people on the system that they use in the US to record these, side effects. So, but whatever it is, at the end of the day, they are of concern to people. And I think I would have been much more interested to know from SAPRA, because this is stuff that comes from the US. I would have been happy to hear more from SAPRA as to what have they been getting, in the local version, that records side effects from people in South Africa.
I'll leave this as my last question to you, Doctor. I suppose this is also not going to help those who still are vaccine hesitant, isn't this? And unfortunately, this is where social media goes. It spins out of control. This is not going to help the anti-vaccine hesitancy movement, is it?
It certainly will not, because if we remember that there was a study done by University of Joburg together with the Human Science Research Council, which actually showed that there are three main reasons for hesitancy, and the top one is the fear of side effects, followed by questions around efficacy and issues of trust. So now this information that was forced on Pfizer for them to release because of the court order reveals the side effects and also reveals what they've always worried about, whether there are any agendas to hide things. So yes, it will certainly worsen the hesitancy, but I hope people will look at things in a proper context and not overreact for at least that happens in less than 1% of people across the world.
So if someone is experiencing any kind of side effects, Doctor, if we could just perhaps take a moment before I do let you go. Most people getting a jab, I certainly had it. I didn't have any of the nausea or any of that, but I had a sore arm for a day or two. Would that be considered a side effect?
Well, again, that is a side effect, but it's an expected side effect. It's mild, it's self-limiting or transient. So that's an expected side effect. I think what we should worry about is what we call unexpected, serious side effects that may leave people with residual damage. And that's what we really should be worrying about. And in South Africa, there is an app that has been developed by SAPRA, that one can get, from the App Store, where you can then self-report. Or you go to the site where you injected so that you can report side effects. And we have been doing that. That's why I'm interested for us to know more from SAPRA what has been the picture.
Yeah, and I agree, and I think you've certainly piqued our interest as well as far as SAPRA is concerned. Guess who our next guest is going to be on this issue as well. But Dr. Nyati, thank you very much. We'll make sure we get SAPRA on as well to unpack some of the side effects issues and have this discussion move forward. So a lot of side effects, but we should not necessarily be that concerned. Dr. Fundile Nyati joining us as well, because Tumza, when you and I had our vaccine, I had mine done on air. You had yours done just after the show. I just had a sore arm, but you did. You felt a bit lethargic and nauseous for what I think was a day or so.
Yeah. You remember, I couldn't even, bring myself to come to work because it did span over even to the following day. I didn't feel good at all, but of course it only took a couple of hours after that, and it was all systems go, I think. But you know that we are due for that booster shot again. If you did get your Pfizer or Johnson & Johnson a couple of months ago, I'm sure by now you have received your text message to get your booster shot. And of course, that is the latest vaccine rollout that is expected to be, of course, administered by the government right here in South Africa. So make sure that you do go out and get your boosters. But with that being said,